So we're here today at Agentforce World Tour London. I'm with Dan Eddy and Claudia Nicholls of Simplyhealth. It's good to see you both.
Thank you for having us. So yeah, super exciting, isn't it? We were up on stage this morning talking to people about our experience at Simplyhealth with AI and automation. You may not know this, so forgive me for explaining a little bit. Simplyhealth is a amazing healthcare company, affordable healthcare, and we are 153 years old. So we have existed twice as long as the NHS, and we work very much alongside the NHS. We have 2.4 million end users who benefit from what we do. And how we help them with access to healthcare is by providing things like GP access, dentist appointments, opticians, physio, scans, blood tests, that kind of thing. So very much everyday healthcare. And what we believe is should be simple to access healthcare. And clearly at the moment with the NHS the way it is, it's quite hard, can be quite hard.
Just a little bit more flavour to that. We, as Claudia's resonated already, our purpose is about improving access to healthcare for all in the UK. So it's really bold and noble. 2.4 million today, let's say 10 million by 2030. We'd love that opportunity to support the NHS and give that affordable access to healthcare. But when we think about that purpose, then there is a real why to why we're using AI and why we've chosen Salesforce to be that partner in helping us use AI, so that we are really clear on why we're using AI in our estate alongside the brilliant people that we have in our organisation to serve our customers and our patients. And the real reason is there we want to be able to scale. We want to be fit to scale from that 2.4 to millions more patients and customers, and Salesforce is going to be that innovator, as we've seen through the advent of Agentforce. It's going to be at the front end of everything that happens in AI, particularly within service, sales and marketing cloud, which we're particularly interested in. So it helps us to realise our purpose, and that's massively important to us as an organisation.
Cool. Thank you very much, both. Let's talk a little bit more about how you first started working with Salesforce. Was it a partnership that came about before the launch of Agentforce, or was that partnership at the start? If you could talk a little bit about how you first began using Agentforce as well, just a little bit of the story behind that would be fantastic.
Okay, I'll let Dan answer that because it's an omni-channel story.
So yeah, Claudia and I sort of three years into the organisation, and we were fundamentally brought here to help that kind of analog to digital transformation in line with helping us to realise our purpose, right? So when we look at the kind of operational landscape, we were very analog. We had an on-premise telephone solution and a chatbot over here, but they didn't talk to each other, and the information, there was no synergy in that information, so they were single channels, and they both kept falling over. So there was interruption in terms of the customer experience. So when we were thinking about that, again, that transformational digital experience, we had to be thinking about a partner that, again, would be at the front and centre of innovation, but also then would give us robustness and resilience through the channels. And when we did, a full sort of RFP across all of the kind of providers in the kind of CCaaS world, actually we had Salesforce in our house already as a CRM. So their offering of Sales Voice Cloud, partnership with AWS, was overwhelmingly our favoured solution, and that's proved to be a really good choice. We've seen, first of all, robustness and resilience within the kind of stability of those channels, but then also our ability to leverage AI within those channels, again, to complement the brilliant people that we have. Now, our brilliant people need to be doing more value-adding things, and so AI can take away a lot of that easy to do, easy to answer questions. And that means that our patients and our customers get speed of answer, speed of resolution much quicker than they did 3 years ago through an ecosystem that we've created with Salesforce as the kind of heartbeat of that.
We sometimes, when Dan and I come and speak, we do a little bit of and here's the real story that we don't normally tell. So we are doing a re-platforming because we're 153 years old. So some of our systems are quite old. And that re-platform is going well, but it's like any good IT project, it's over budget and late. And we had efficiencies in the budget, in the plan, that we still had to deliver. So that, as well as the fact that the customer experience was not good and our phone system kept falling over, made us think harder and faster about what do we do now? And that's in part how and when and why we brought Salesforce into the business.
Thank you very much. Aside from using Agentforce, I imagine a company like yours uses AI in other contexts too. It would be great to know the other sort of impacts that AI can have on a healthcare company specifically, because, like you said, Agentforce is really good at, cutting down on inefficiencies, helping you out with repetitive tasks, that sort of thing. Is Simplyhealth using AI in other ways, in sort of more practical healthcare applications?
Yes, we are. So, like Dan explained, we have used AI first and foremost in the customer service experience as one of the moments of truth. But if you imagine, if you find a mole on your arm and you're worried about it, the worst thing you could experience is that you have to wait. So you don't want to wait, you want to know fast what's wrong with you. So we use technology in a number of ways. We help you figure out quickly what's wrong with you, and we help you get access to health professionals that can help treat you. So in the physio example, we've got a partnership with FIO, and they use AI on hundreds of established clinical protocols to help you understand what your particular diagnosis might be and what the appropriate treatment plan would look like. We use AI also as part of our triage with our virtual GP and with the mental health support for EAP.
Yeah, and if we focusing a little bit on those moments of truth, then AI is also used within our claims automation processing. So if you think about the current economic crisis or financial crisis that most of us are facing into in working Britain, then you want your money back after you've spent it on a physio or a dental appointment. You want it back in your pocket pretty quick, because that might be £50, £100, £150, right? So the automation of claims and the kind of our analysis of our risk appetite in terms of what is the history of a patient or a customer claiming, and how we can push that payment back to the customer as quick as possible. So our kind of receipt reader AI automation allows that kind of very, very quick analysis and straight through processing of claims. Our average speed to process a claim and press the pay button last year was 0.83 days, slightly over that this year, but still under a day. And fundamentally, that means that then once we press the button, the back's process of paying the customer back is in someone else's hands. But we have got some fantastic examples of where customers have caught the back's process perfectly, and literally within a couple of hours they've got the money back in their bank accounts. So that's another great example of where AI is at the moment, at the point of truth, it's providing real benefit.
The other thing that we're working on that's not yet a reality, but what we're excited about, is the ability for AI to help with prevention and early intervention. So how do you connect the data up so that, I'm a glasses wearer, I have an eye check pretty much once a year, sometimes more often than that. So you can use the data to say, hey Claudia, last year you did that in September, we're now in August, would you like us to help you plan that in? And because of our scale and our network, we then say, well, if you go to the optical network that we have relationships with, we use our scale to negotiate better rates for you. So we clinically vet them, so they're handpicked, so they're really good, and then we use our scale to bring the cost down. So we remove barriers of simplicity, reassurance on quality, and more affordable pricing. So technology can really become a flywheel for better health outcomes, and that's, I think, super exciting.
Yeah, brilliant. One last thing, if I may. So I suppose inherent in the question was what other AI have we used? And we've been using conversational AI for kind of 2.5 years now. It's really important to say this because we don't use Salesforce in that voice lane at the moment. That's not why it's important, but it's important that we've been able to. We had a problem to solve, which was speed of answer on the telephone, and conversational AI answers every phone call within 2 seconds, right, and then resolves 35% of that itself. Now that's really great if you're a customer and you're not. If you think in the broader analysis of all industries, there's lots of heavy wait times, right? If you go into the utilities, into the aerospace, you'll be waiting for hours, right, to get through to a supplier. So for us, that's really important. That speed of answer means that customers and patients are getting a quick answer, and if not, they're getting through to a human really quickly. And conversational AI is identifying and verifying our customers, taking 40 seconds after every kind of human interaction. And at the back end of that, we have conversational summaries. That is through Salesforce. But what it's allowing is that total handling time from start to finish to be smaller, and therefore our productivity kicking up as a result. Now, when we talk about scale and our delivery on our purpose, that's really important to us because it means we can serve more patients and customers in a day.
Cool. Thank you both. That's a lot of amazing applications for AI in your business. So I'd like to talk about the targets that you mentioned. Obviously, you're wanting to scale the business more by 2030. Just wondering how AI is helping with that. How you're growing. What sort of rate is that? Is it making a marked impact on your end results?
Yes, it is. So because we've been working on AI for 2.5 years now, we've been able to not just get stuck in pilot land, but this is just how we operate, how we run the business. So in terms of the customer experience, and that's ultimately what matters, right? Does the customer notice and do they like what AI is bringing? We've moved our Trustpilot rating to 4.5 out of 5. So they notice. We measure customer satisfaction through regular quantitative surveys, and that's gone really, super high. So our very satisfied rating it varies a little bit, but it's roughly 72%. But then if you look at overall satisfaction, so fairly and very, is in the 80s. So there's not many people that can say that. We have been able, like Dan said, so 30% of questions are answered by conversational AI there and then. On our email processing, which is generated, that's Agentforce basically, generative AI. We were the first in the world to do that with Salesforce. And that made us proud, right? That was little Simplyhealth that was doing that. And we are now doing 1,500 a week. So that's significant. And all of this combined has generated significant efficiencies. So the teams are smaller. But what is wonderful is we've not had to do that through the redundancies. It's just natural attrition. And what is also important to say is we pay people on average 35% more because we recognize that we've taken the boring stuff out of their jobs. So what they do is add more value, empathy, the more complicated cases. So there are some of the stats, and Dan will give you some more.
So a really important point that Claudia made from our colleagues at Simplyhealth, the transparency of what we're trying to do and why, right? So that connection back to why I'm working alongside AI is because we want to be able to deliver on our purpose, right? Be fit for scale. So productivity inherently is really important. So if we're able to serve double the amount of customers in a day because AI is able to serve some of those and the human is able to serve the more complex and value-adding services, then that's exactly as we want it. And we'll pay more to the human because of that value, the colleague because of that value. And what we've done in 2.5 years is actually 2.5 times productivity, so which is fantastic, right? So it was 25 customers a day. We now serve between 50 and 60 customers in a day because of that capability. Now that means from an efficiency perspective, we have got smaller teams and we've saved, millions of pounds in operational costs. That makes us fit for scale, right? Because we're commercially more agile to be able to cope with growth. And Claudia's role across sales, marketing, and service gives her that oversight of how we grow and how we can achieve personalised experiences, continue to grow satisfaction and advocacy for Simplyhealth and Dentplan as brands, whilst making sure that operationally we're on point from a budgetary perspective.
Thank you very much, both. That's great. Just a couple more questions. I'd like to talk a little bit about the future and how you see AI impacting both your sector and others more and more as the years go on. Hard to predict now because things move so fast, and like you said, in just 2.5 years, it's been pretty transformative. But do you have any thoughts on where things are going, and are you optimistic about it?
Yes, so what we're wanting to do is now replicate some of the success that we've seen in customer service applications into sales and into marketing. And that's where we're now deploying Agentforce. So we're doing a number of things. We're helping our sales teams by removal of the admin. So what are the types of things that the best place to start when you do AI implementation is, what do you not like about your job? What do you find boring? It's brilliant because that tells you where you need to go. So what are the repetitive questions that are time and time again the same? Adds no value to anyone's job, so you might as well automate it. So that's what we're looking at. We're looking at sales coaching. So some of our sales teams are better at selling than others. Well, why is that? Can we decode that? And can we help then that information, that data, to upskill everybody? We're looking at things like T's and C's, terms and conditions. Adds no value to anyone's life, but they're important. So how do you make technology help any questions that a business that it has a policy with us might ask us? So those are some of the things that we're doing. So I'm hugely optimistic and excited. I'm impatient about, what, because being at this conference today, I think it's amazing to hear what other people are doing. I'm amazed at how many people are stuck in a pilot, right? Not that many people are doing anything at scale. So that makes me think we've got a real opportunity for making this a competitive advantage. What I worry about, you didn't ask me this, but I'll give it to you, is what I call the sea of sameness. Because when you use Agentforce, you can make it have a different tone of voice. You can say informal or formal, and there's a third one I've forgotten. But it's still all the same. I don't want it to be the same because we are Simplyhealth. We are there to improve access to healthcare, and by doing it simple, we want to make stuff simple. So I want to call a question, not an inquiry. And healthcare can be complicated. So how can we have our tone of voice in our application of AI and Agentforce? That's what I'm worried about, to fight against the sea of sameness.
So I think, to Claudia's point, we can continue to use AI in the channels of choice for our customers and patients, and we can reach, I think, a ceiling of simplicity with that. That's not to say we can't go beyond 60-70% potentially, right, over the coming years. Why wouldn't we? And that'll be 24/7, 365, right? So again, kicking up that level of productivity. So that's exciting, right? There's lots of use cases out there for us to go at in sales, in marketing, and in service. So it's incredibly exciting from that perspective. But I think when you think about AI outside of our organisation, it's a really interesting question. Because if you think about the Gen Z population today, and I use Claudia's phrase here, they're incredibly impatient. And there's a reason why they're impatient, right? There's access to social media and AI. Think about the accessibility of ChatGPT and the answers that gives, or AI within any kind of social media app that gives you answers or thoughts or ideas. And therefore, the immediacy of I want, I need, and if it's not ready, I'm impatient. Give you a quick story here. My brother's son, who's 14 years, just opened his first bank account, and his dad was helping him do it. And the day after, he was like, "Where's my card? Where's my card?" And my dad was like, "Well, you'll have to wait a bit longer." 2 days later, dad's at work, gets a message. "Card's still not here. I don't want to do this anymore. It's not very good, is it?" So, that because things are always at their fingertips, answers, questions, So where we're going with what I'm stating here in that story is, how much further do we actually go and use AI in a kind of outside of our work life to make things so easy that people don't have to try hard and work hard and have effort in what they do. And there needs to be a balance to that, right? As we move forward and things become even more automated as we move through the next 5 to 10 years, there is something about us as humans taking a grip on our own welfare when we come to use AI. So that's a concern we have, and that's something that we'll keep at front of mind as we use AI in our business.
One more thing to add, which is new for us, is that we just have signed off that we will implement generative AI without a human in the loop. And the reason we feel comfortable-ish in doing that is because we have added AI in our quality assurance. So rather than sampling 3 or 5% of your interactions, the technology allows us to sample 100%. So if you think about it, it can't then really go wrong in your generative AI or Agentforce application because 100% of it will get checked. And if there is anything going wrong, you'll learn it really quickly. So that's probably another area where we're leaning in more than other people. I haven't heard many people talk about that. You hear them talk about human in the loop, which is, of course, most of the time correct, but we are ready to now go generative without human in the loop. And that's exciting.
And I think also the 2.5 years that we've been using AI gives us the kind of roadmap or the runway of experience, right? So we started with the human in the loop. So our jump from human in the loop to not having a human in the loop is less of a risk for those who are going straight to autonomous responses. That's a fair old jump, right? Depending on the kind of data. We're tried and tested in that space, right? So we have that confidence and assurance alongside the QA.
Thank you both. Just time for one more question. Another sort of forward-looking one, but a little bit more specific about the health sector. You mentioned that you do some work with the NHS as well, and it has had a little bit of a struggle, and it's been going through a period of struggle recently with waiting times, inefficiencies, lack of staff, that kind of thing. And I was just wondering how you think the health sector will look after AI has had the chance to bed in for a few years, and whether that will not only affect your business but also the NHS as well.
That's quite an all-encompassing question. So I think, based on personal experience, the NHS is brilliant, right? When you can get access, it's absolutely brilliant, and you can't fault it. And the nurses and doctors in the NHS do such a brilliant job. But what we're seeing is that demand outstrips supply. And we think and believe that will continue to be the case for a while. So there are 7.8 million people who are on NHS treatment waiting lists. There are 2.78 million people who are off on long-term sick. And of course, those two things are connected. So what we try and do is help businesses look after their employees as a way in. And how we look at technology is as a way to make that more affordable and more accessible. So that's the future, combined with what I touched upon before. If you really properly use data, and if you connect it up, and if there's one place that you can go, so you've got a health niggle, you come to Simplyhealth, and we will help you. We won't do all of it, right? The NHS is a brilliant place for, if you have to have hospital treatment. But for all the other stuff, the everyday, we will help you. We will help you navigate that complexity. And that's ultimately where we think that technology will go, that it is in one place, it's all connected up, the patient is in control of their data, and the technology will allow you to find out sooner what's wrong with you and get the treatment you need.
And I think the only thing I'd add to that, and I suppose it's a macro picture of the micro one we're trying to create, is the ability to have that really speedy access and to be supported by AI in doing that. And imagine walking through a kind of digital doorway, and at your point of need, there's a physio, there's GP, there's MSK, there's mental health, there's menopause, there's whatever it is that you need, and you can buy that digitally at your point of need for you and your family, right? That kind of accessibility prevents you from being one of the 7.8 million in a queue. So, and if you've got a question, I can ask a question. How much will it cost? How quickly can I get an appointment? And AI can provide that because it will be linked to the data that's patient held, right? So I think that's how it can, from our perspective, if we look sort of inside our own organisation, how we can help in that journey. But I think wider than that, there is more digital capability that needs to come to market to solve the problems that Claudia's described.
Thank you both very much for joining us today. That was great. Have a great rest of the event.